It is. You know, next we may discuss, well, who are the 2 out of 10 people that may need to have it done in a hospital or surgery center? Because it's fair to mention those people.
So let's talk about that a little bit. If naturally you're giving a general scope of what you think, typical 10 patients, 8 come in, you could help them. But you're going to run into a couple of roadblocks where you got 2 of them that might be a little worse off. Can you talk about that?
Sure. In order to place the balloon, in general, the nasal septum has to be straight. For example, boys will be boys. You're playing ball growing up, you get hit, you get a deviated septum. Well, if I can't even see the opening to the sinuses in the clinic, and then it's confirmed on the CAT scan, well, the patient needs a septoplasty. I had to help a lady this morning who had a septal deviation that was so bad that I had to do the septoplasty to be able to open the sinuses on the right, and then that is someone who is the perfect candidate for the hospital and the surgery center. Or in general, if patients have polyps. Now, a polyp we've talked about is growths like grapes. Well, those polyps have to be removed via a microdebrider. And in general, balloon sinus procedures are not indicated in people who have polyps. You're supposed to remove the little polyps first. So those are 2 of the main reasons patients may need procedures in the hospital or surgery center. And even now, those procedures, the results are incredibly better than they used to be because we're using irrigations after those procedures in the patients who need to go to the hospital and surgery center. In fact, I will place patients on irrigations the week before the procedure for 2 reasons: to cool off and reduce the inflammation in the nasal sinus area, but to get the patient used to using it. And then when we have to open the sinuses in the hospital or a surgery center, I'll leave a little sponge in the sinuses where I did the work, but the sponge dissolves on its own so I don't have to remove it, and I'll leave numbing medicine on the sponge. And as they irrigate over the next few days, it just comes out like a little strawberry jelly. So that encompasses the 2 out of 10 people that would need their sinuses addressed in the hospital or surgery center. But even now with the use of the irrigations and topical medicines, even though